Welcome. It's my extreme pleasure to serve as the moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of Real Talk MS, a podcast that every week reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all the work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. I see that people are continuing to join the webinar, so let's give them just a few more seconds and we'll get started. This webinar is really all about getting answers to the questions that are on your mind. So before getting underway, I want to review how you can submit your questions. If you're connecting through GoToMeeting, you had two options to join the webinar, either by phone or using your personal computer. If you joined us using your personal computer, well, you'll have the ability to submit comments and questions through the chat box that you should see on the right-hand side of your screen. If you happen to join by phone, then you're going to be in listen-only mode. Today's webinar is also being streamed live on Facebook and YouTube, so welcome to everyone with us on both of those platforms. If you have the ability, I encourage you to submit your questions and comments as we have a team capturing those as well. As I chat with our expert today, you can submit your questions as they come to mind, and we're going to address as many of those questions as we can. Now, I know many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. And I'll let you know how you can reach an MS Navigator before the end of today's program. Now, obviously, I can't make this webinar happen all by myself. There's a whole team of amazing people working behind the scenes. And one of them is Julie Fiel. And Julie is going to help me today by pulling together your questions in the background while I'm busy talking. We may even get Julie to pop up and read some of those questions herself. I should also mention that due to the large number of participants we have today, everyone has been placed in listen-only mode. And if you're interested in reviewing today's discussion with our experts, this webinar is being recorded, and it'll be available on the MS Society's website for your reference. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering. So I hope you plan on joining us each week, and hearing your questions and listening to what's on your mind is going to help shape future Ask an MS Expert programs. So I hope you're ready to participate. Our objective today, and our objective in all of the Ask an MS Expert programs, is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind, the topics that really impact people who are affected by MS. When we read through your feedback on previous Ask an MS Expert webinars and we look at the questions that we're continuing to receive, it's clear that COVID-19 will continue to be a hot topic in all of our lives for the foreseeable future. So we're going to continue providing the latest updates on the key questions that keep coming up, as well as the new information that's trending in the news this week. Today, we're also going to be talking about managing MS symptoms. And of course, we're going to spend time answering the questions that are on your mind. We'll also share some key resources that you can turn to anytime for credible, reliable information about COVID-19 and MS. Now, before we dive in, I'd like to acknowledge that these are new and rapidly evolving times, so we do have a disclaimer to review. COVID-19 is a new coronavirus, and there are currently no published data available about the virus and MS. The information and recommendations presented in this program are based upon the professional opinions of MS experts and the evidence currently available about MS, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we'll update information as it becomes available. The information that is shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. And be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. Now let's meet our expert. Dr. Elizabeth Crabtree is a medical director at the Tulane Center for Comprehensive MS Care, and she's passionate about creating meaningful care models for patients living with multiple sclerosis. Dr. Crabtree did her undergraduate studies in neuroscience at Reed College and her training in immunology at the University of Tokyo in Japan. After medical school at Tulane School of Medicine, Dr. Crabtree completed her residency at the University of California in Los Angeles. Her first fellowship focused on neurobehavior at Tulane, and Dr. Crabtree was on faculty until Hurricane Katrina prompted her relocation. She spent the subsequent 12 years focusing on MS clinical care and patient education at the University of California in San Francisco. And now Dr. Crabtree has returned to Tulane to build a comprehensive care clinic for patients with MS. Her interests include patient education and support, maximizing the role of nutrition, exercise, and stress reduction for her patients, the management of MS during pregnancy, and meaningful symptom management in MS. Dr. Crabtree, thank you for joining us. We're now going on week 7, and we're committed to keeping everyone updated on the latest news about COVID-19 and MS. Last week, we covered information on the first at-home coronavirus testing kits that were approved by the FDA. We talked about MS registries, updated guidance on the use of MS disease-modifying therapies during the pandemic, and we looked at the reopening of businesses in some states, as well as exercising to stay healthy while we're at home. Some of the questions we're getting this week are about the different drugs that are being tested to determine whether they offer any benefit in fighting COVID-19. We heard from David, who wants to know more about Pepcid being tested. And people continue to ask about chloroquine, hydroxychloroquine. Just this week, we're hearing about remdesivir. What do we know about some of these different drugs that are being tested?
Yeah, well, firstly, thank you for having me, and thank you for that lovely introduction. We are very aggressively pursuing treatment strategies for COVID. I want to stress to everybody on the call today that it's very important that you not seek prescriptions for these things until they are tested. Sometimes in medicine, we understand a certain model, or we generate a certain model, and we base our therapeutics on that model, only to downstream find out that we missed a step or got something not quite right, and something that we thought would be helpful is actually deleterious. For instance, the interferons that are used in MS, some of you might still be on things like Avonex, Betaseron, and the likes. That medicine was found accidentally when we were trying to actually induce a health issue in mice. So the big take-home message from that piece is just to please await data that includes safety data for any of these. I like the examples you gave of some of the drugs we're looking at, because they each work a little differently. And the question about Pepcid and what are called H2 blockers is an interesting one, because we tend to think of it as it helps with reflux and they're stomach-based. What many of you probably know, if you're in the MS community and following the microbiome research that we're doing, it's not just acidity in the stomach. These medications, not just Pepcid, but the others, can change the microflora that then changes the interface between your gut microflora and the immune system. So we're not positive of the mechanism for things like pepsid, but it might turn out that it's not as simple as reducing acid, that it's actually promoting health promoting bacteria profile in the gut. The other things that we're looking at, like the hydroxychloroquine and the other antivirals, can be thought of just like as that they interfere with viral replication or viral entry into cells by affecting an enzyme or a protein that our other cells, our healthy cells, won't be affected by. We always try to do this in medicine. You try to come up with a target that's very specific so that you get your desired effect from the medicine and as few unwanted effects as possible.
You know, we're also getting questions about COVID-19 immunity and pre-symptomatic transmission.
Yes.
Tammy wants to know whether we've seen evidence that if someone tests antibody positive, does that mean they're immune to getting COVID-19 again?
Right. So great question, Tammy. In general, sorry, I have a new cat. You can see behind my head. That's Charlene. In general, when we beat a virus or an infection, we've done that by mounting an immune response that includes an antibody response. And we're very fortunate that the cells that make antibodies, called plasma cells, stick around for a while. So in general, after a viral infection, we do have immunity. Keep in mind that sometimes that's incomplete immunity. I'm sure some people on the call today got chickenpox more than once, and everybody knows that they get boosters for certain things, and that's because the immunity doesn't last. Our hope is that following a COVID-19 infection or exposure, if you test positive for the antibodies, that you should have immunity. And we do believe that to be true. There have just been some unforeseen discoveries with this virus that we have to be a little careful. And I can't stress enough that even if you test antibody positive, you probably are immune, but I would still recommend that, especially now while we're going through the phases of reentry, that you engage in all of the same practices in terms of regular hand washing, wearing a mask in public, and keeping your environs clean at home.
Well, we're going to circle back to that issue of reentry in just a moment. Before we do, John asked, how likely is it for people not to have symptoms but still test positive for COVID-19?
So that's a great question, John. And sorry, I didn't answer the question about asymptomatic carriers. So I can't give you a specific number, John, because we have not done the kind of widespread testing that you really need in order to understand, in order to generate your ratio that results in a percentage, right? So you have to have asymptomatic people tested across the board to understand what percentage they constitute. And we're just not positioned to do that yet. People who are asymptomatic can absolutely be infected. And it's unfortunate because you don't know that you're pre-symptomatic. But when you don't have symptoms, but you're about to become symptomatic, the viral shedding is actually higher than when you spike a fever. So in that pre-symptomatic phase, people are potentially more infectious than when they're actually febrile and have shortness of breath. So unfortunately, yes, asymptomatic carriers can infect other people. And I don't have a good number for you what percentage of the population is asymptomatic. I think that once we have more widespread testing, what we're going to find is that a lot of people had asymptomatic exposure, similar to what we see with the Epstein-Barr virus or mono. Anyone on the call today, you can think, did I have mono? Did I miss school? Did I miss work? And there's going to be some percentage of you that had symptomatic mono. If I tested your blood for the antibodies to that virus, if you have MS, 100% of you would test positive. So that's an example of another virus that causes an asymptomatic immunity. Your body still produces the antibodies against it, but you never had a symptomatic infection. I think that the rate for COVID isn't going to be quite as high as Epstein-Barr virus, but I think it's going to be very high, especially in our young adults. Yeah.
You mentioned spiking of fever, and we know that fever, cough, shortness of breath, or difficulty breathing have been the key COVID-19 symptoms to watch out for. Have there been updates to what we know about COVID-19 symptoms?
Yeah, so great, again, great question, because all of these questions and answers are evolving as we move forward and as we learn more. Excuse me. The classic presentation of fever, cough, shortness of breath, and overall body aches or myalgias is still the most common constellation that we see. People also report headache, and it can be a bad headache that lasts for weeks, chest tightness, muscle, not just, you know how right before you get the flu and you feel icky, you know it's coming. There's an even more profound muscle pain that some people report. And now that we're learning that one of the effects of the virus is that it can actually increase your risk for forming blood clots, please do keep your eye on if you suddenly have unexplained swelling in one of your legs, or if you have chest pain that could suggest something of cardiac nature. Those can be signs and symptoms associated with COVID.
Dr. Crabtree, I know, especially right now and in the days and weeks to come, everyone is really keeping a close eye on the states that are starting to reopen for business. What should people who are living with MS keep in mind as businesses start to open?
Yeah. Look, it's a really tough time for all of us. We want to be safe. We also need to be able to sustain ourselves, and so it's a very very conflicted, right, in terms of reentry. It is important for all of us, whether you have MS or not. It's very important for all of us to continue to undertake best practices. And so as you progress through the phases of reentry, please do always wear a mask when you're out in public. Please practice social distancing until your area has progressed to the phase that doesn't require that. And again, the hand washing and keeping surfaces clean, it's imperative. If your local businesses start to open, I personally, maybe there's too much information, but I definitely need a pedicure. But that's the kind of thing that I would really caution people to jump right into. And if you just absolutely, for peace of mind and your personal wellness, do need to do some of that self-care or get those services, wear a mask and ask your provider to wear a mask. We really have to be careful with this reentry phase because of the asymptomatic carrier status. If things reopen too quickly, I'm very concerned that we'll see another spike in cases.
You know, I'd like to shift our discussion to talk about MS symptom management. Throughout these webinars, we've been hearing from people who have recently been diagnosed, they're relatively new to MS, and they have lots of questions around symptom management. Teresa wants to hear more about just coping with the challenges of daily living, given fatigue, spasticity, and the cognition issues that are related to MS. Tamara says she's been diagnosed with MS for less than a year and is wondering if stress over the COVID situation is making her MS symptoms worse. Luis says he's new to MS and wants to know if there's a specific diet. I'm wondering if you can just maybe review some of the common symptoms people living with MS are likely to experience.
Sure. So firstly, to Tamara and Luis, welcome to a very caring and nurturing community. I'm very sorry that you are entering the community, just because I would love everyone to be well and circumvent a chronic disease. On On the other hand, you are coming to MS in an era where our treatment strategies and our treatment success is just leagues above where it used to be even 20 years ago. So we are seeing less and less disability and less symptomatology in our patients. Symptoms from MS, if you look it up on the internet, you'll get overwhelmed because it looks like a huge laundry list, paragraph almost, and you think, oh my God, am I going to experience all of those things? And the answer is probably not. Most people do not experience all of the symptoms that are on that list. The most common symptoms depend upon where the disease activity has been. And so certain symptoms run together because they're interconnected, phenomenologically. They're interconnected in terms of what they cause to one another. And then some are occur in a cluster because of where the MS lesion is. So, so for instance, fatigue that you mentioned is it is the most common MS symptom. And it often runs with challenges with cognition and even challenges with mood, whether it's depression or anxiety. And for somebody who's just coming to this world of MS and it's been under a year, this is still new for you and still new to be processing all of this. And so it would be unusual if you didn't feel some anxiety or even depression associated with the new diagnosis. But that's definitely something that we want to keep your healthcare providers aware of, because again, we're leagues better at helping people with symptoms as well. So that constellation of fatigue, cognition, and mood runs together because they impact one another. And then sometimes things run together because of where the MS plaque is. So if you're somebody who took a small hit to your spinal cord, what we call partial myelitis, then often people will have some combination of weakness or numbness in the legs, tightness of the muscles in the legs or muscle spasms, bladder and bowel, and fortunately, it's usually not incontinence, thank goodness. It's usually on the constipation side, and then with neurogenic bladder, it tends to be urgency and frequency. And along with that constellation, gait or balance is often affected. So those two clusters are some of the most common. Many of you, I'm sure, experienced optic neuritis or blurriness of vision in one eye as your first event. That's very common. And then lastly, a very common presentation is double vision. It's one of your eyes can't move in the way it's supposed to when you're moving your gaze. So for instance, this is my left gaze. And so I'd be able to move my left eye outwards, but I wouldn't be able to move my right eye inwards. That's called it's got a long name, but it's an INO, internuclear ophthalmoplegia. And so the symptom that goes with that is double vision. There's a lot to do for symptoms. And I think instead of launching into that, John, did you want me to focus specifically on nutrition or strategies for symptom management in general? It's a huge topic that I love to discuss. I also don't want to monologue and bore people.
I doubt you're boring anybody. But yes, maybe you can give us a bit of an overview. What are some of the things about managing MS symptoms that people who have been recently diagnosed that they should know about? And then I'd love it if you can get into nutrition and explain why that matters a little bit as well.
Sure. So firstly, managing symptom management for each of you is going to be a little different depending on what your challenges are, what your personality is, and probably the person you interface with clinically, whether that's your nurse practitioner, general neurologist, MS specialist. There is a delicate balance with symptom management because it starts with symptom experience, right? Like I'm talking about management. You guys are actually experiencing these things. And so there's a balance between you want to monitor yourself responsibly, but try to keep yourself in check because you don't want to fall into the trap that is very common that I would call hypervigilance. Right now my shoulder is a little achy. If I had MS, I'd probably wonder, is that MS? And especially during your first couple of years with this, almost anything you experience in your body, you're going to wonder, is that MS? And then it can cause some anxiety. So firstly, I would say, work with your healthcare provider to find that balance for you in terms of responsible monitoring, but also avoiding the trap of hypervigilance. We are fantastic at helping people with certain symptoms. We're great at helping people with fatigue, mood, bladder, bowel, endurance, gait stability, strength. I'm sure I'm forgetting some. I know someone specifically asked about spasticity, and that's an area of interest for me because I feel like currently the medications we have are not great, and we cycle through them, and we have you try 3 different ones. And I don't want to speak too disparagingly because they're always responders, and maybe you will get benefit from one of those meds. But suffice it to say, I feel like we are very adept at and successful at helping people with certain symptoms. Definitely what I don't want you to do is I don't want you to feel like this is the new me. This is the hand I was dealt with. Now I just have to learn how to cope. I hope nobody on the call does that until we've really systematically gone through your list of symptoms, created a roadmap of what a dress would look like. A lot of things are interconnected. In fact, sometimes the first step in fatigue management is bladder management, because it turns out you're getting up 3 or 4 times during the night to use the bathroom. So you need someone with the big view to create that roadmap for you. And so I would look at it like that. To initially, you might want to journal things until you understand what you and your provider understand what symptoms are MS directly, and then maybe what things are MS secondarily, right? So you might have lower back pain, and your neurologist is going to say, well, you don't have a lesion there, so that's not MS. Well, if you have a lesion up in your neck and now your right leg is weak so that your walking is different, then that's a secondary MS symptom, right? The MS is causing the leg weakness, and your compensation for it is causing the back pain. Anyway, getting back to the idea, it's helpful to end up with a list of the things that are that you're experiencing. You're not expected to know what everything means, but your healthcare provider is, and that's where we come in and help to discern how things are interconnected, what things are due to MS, and build that roadmap so that we can help with all of the symptoms rather than just plucking out one at a time and you end up on a stack of prescriptions.
I'd like to talk for a moment about the role that nutrition plays in MS.
Mm-hmm.
Explain a little bit about how nutrition impacts people living with MS and the kinds of things they want to keep in mind.
Yeah. So cut me off if I start talking too long, because I am a full proponent of nutrition in health and in the health of my patients with MS, the health of people with MS. They don't have to just be my patients. We do not have one validated MS diet fits all. And there are a handful of very helpful diets or nutrition plans out there. Different things work for different people. I feel confident that during our time together with this, we will get to a point where we can practice precision medicine. It will probably involve taking a blood sample and a stool sample, and then I could tell you as an individual, these are the foods we want to highlight, these are the foods we want to avoid. We're not quite there yet. And so what are some basics that we know? Well, there's pretty convergent evidence, except for one data set. There's pretty convergent evidence that high salt is not helpful for our patients. If you think about longevity, it's not the MS that tends to lead to our demise. Ultimately, it tends to be good old-fashioned cardiac and stroke and cancer. So if you look at the AHA, the American Heart Association guidelines, it's recommended for a low-salt diet. Turns out that low salt is probably better for our patients as well. I recommend a low-salt diet based on that data. What we know about omega-3 fatty acids, what are called PUFAs, polyunsaturated fatty acids. We know from epidemiologic studies that people from regions with higher fish intake have less severe MS and less disability. When we look at island cultures, the folks in the perimeter who have more fish have less disability than the folks internally who eat more meat. There are confounders there, right? The folks who are on the shore might get outside more. Maybe their vitamin D is higher, right? So not entirely sure, but we have other data to suggest that omega-3 fish oils may be helpful for our patients. You won't overdose on it, but I wouldn't want people to take more than the amount that we've studied. So 1,000 milligrams of two of the omega-3s. One is called EPA, the other is DHA. Those two things should summate to 1,000. That's what we've studied. Some people will propose that you should take more, and the real answer is I don't know because I don't have the data yet. But I would caution against taking 3,000 milligrams or more, because at that point we can see what's called an antiplatelet or blood thinning effect. If you look at other just I was just going to say other things. That one thing that I think is very important is vegetables, and we should separate vegetables from fruits because their constituents are very different. And we don't have a specific guideline for MS patients, but if you look at AHA, American Heart Association, it's 3 to 5 cups per day. And if you look at some of the data that our pediatric MS center collated, looking at the kids with MS, the kids who had more vegetable intake had less inflammation, especially the kids who had more than 3 cups a day. Kids have more inflammation than adults, so it is easier to see an impact. But I think from a cardiac standpoint and what we know from the pediatric literature, I do recommend, I don't know exactly how many grams or cups each of you should have, but you should definitely be getting vegetables every day, and ideally probably in that 3 to 5 cup range.
A moment ago, you mentioned vitamin D, and I'm glad you did, because we've actually received several questions about vitamins like vitamin D and biotin and their effect on MS. What can you tell us? Well,
firstly, I love it when we get a win for something that's not a huge, expensive pharmaceutical. And that's what these are. These are our wins, not for everybody, but vitamin D is not a vitamin. It's a hormone. We classified it wrong. And most of our patients have that hormone deficiency. We have very convergent data showing that a blood level of 50 to 70 of the vitamin D, on your lab slip, it'll say vitamin D-25OH, that's hydroxyvitamin D. We want that level to be between 50 to 70. We're looking to see if 70 to 100 is even better. I don't have that data yet. But with vitamin D, it's not just for bone health, which is important. People with MS are at a higher risk for osteoporosis, so bone health is important. But I think what's even more exciting about vitamin D is that now we know that it actually helps with the autoimmune process itself. And so and we have a data set, again, from the pediatric population that having a higher vitamin D level was correlating with less disease activity on MRI. So if you have MS and you are not taking vitamin D, please have your physician check your level and instruct you how much to take based upon your level. Although it is hard to become toxic on vitamin D, what can happen for folks who are prone to kidney stones, high vitamin D, high blood levels of vitamin D can increase your risk for kidney stones. And so we don't want to inadvertently tip one of you over into that very painful syndrome. So vitamin D, to me, is a disease-modifying therapy. It's essential. On my comprehensive care plan, it's number 3, right after diagnosis, disease-modifying therapy, vitamin D. And I think that's true for just about any MS specialist you'd speak to. In terms of biotin, I was so excited when the initial biotin data came out. Very small study from France, but these were all all people with progressive MS, and over 90% of them got better with high-dose vitamin D, high-dose biotin. That, even though it was a small group of 23, 24 patients, very exciting. The follow-up study that was done much more systematically, the way we like to do it, where you have people randomly assigned to placebo versus high-dose biotin, still did show that some people improved, not just stabilized with progressive MS, but improved. But the response rate dropped to 12.7, about 13% of patients were responders and actually experienced improvement. Biotin is a form of, it's one of the vitamin Bs, and it all of vitamin Ds are what are called cofactors. So they help some enzyme do its job that would be flustered isn't the word I'm looking for. The enzyme can't work until the cofactor's there. And so biotin is a cofactor in we've identified 5 different carboxylases. Carboxylases generate the energy for your cells, called ATP. And a lot of my patients will report that they do pretty well on the front end of the day, and then by the end, their legs are getting heavy or weak. That might be ATP depletion. And so biotin is exciting on that front. It is not for everybody. We don't have strong data for our relapsing remitting patients yet, unless it was just published recently and I'm unaware of it. But to my knowledge, it's our progressive folks who might get benefit. At that point, you have to think of what are the dangers, what's the cost, should I just try it if I have progressive MS? And firstly, you shouldn't do it based on our call today. You should always talk to the person who's overseeing your care, but it's not that expensive now. Now, we used to have to get it compounded. Now we don't have to. In terms of danger, again, it's hard to get toxic. You do need to check your thyroid before you go on it, and you do need to do an EKG before you go on it. Not because it hurts those organs, but because it messes with the way we measure it. It messes with our assays. So that if you get your thyroid checked, once you're on high-dose biotin, you're going to get a phone call from your primary care so fast saying, oh my God, your thyroid's on fire. Say, no, Dr. Crabtree said it's the biotin. And they won't believe you until you go off the biotin for 3 days. Suffice it to say, we want to get your pre-biotin reading. The cardiac, the reason is because, again, biotin isn't going to hurt your heart, but the main blood test you do, anybody who comes into the ER with chest pain, we do an EKG and we check something called troponin. The assay for troponin is biotinylated. And so the biotin in your blood throws off your cardiac assay, and you might test negative when you're actually having a heart attack, but you might test positive when you're just having reflux. So again, have a baseline EKG, keep it on your smartphone. If you develop anything that takes you to the ER, you'll have that baseline EKG.
You know, we're getting some great questions. I know early on you mentioned mood and anxiety. Can you tell us a little bit about how stress impacts MS, and now that so many people are experiencing heightened stress levels, perhaps you can share some tips on how to best manage that stress?
Yeah. Thanks, John. Again, a great question. And I want to come back to, I think it was Tamara, or maybe it was Louise, who asked about how the anxiety is affecting their symptoms. And MS symptoms can escalate and feel just like a relapse when you're not forming a new plaque, but old disease activity feels like it's coming back. It's usually not as strong as your first exacerbation with those symptoms, but that's what we call a pseudo-exacerbation. And one of the most common precipitants of a pseudo-exacerbation is stress. Probably the most common is a urinary tract infection that you don't feel the burning or pain, so it's urologically silent. And then number 2 is probably stress. And look, it's not that anybody is weak-willed or that somebody has psychological problems. The way our brains process anxiety is intimately linked to our gut flora and our immune system and our overall health. And so stress management should absolutely be part of your MS care, because stress is something that we all have it, right? And so we might not be able to always change our external stressors. Like currently, what can each of us do about, we can't change COVID, really. You can change how your body processes it. And so that's the role of stress management. And again, that's about number 12 on my list for comprehensive care, but it's definitely on my list for every single patient. And then sometimes we spend a whole session identifying avenues of stress, and then a foundation of strategies to manage, and then a toolbox, a toolkit for crisis management, because we all kind of get in those crisis situations. And by the way, when I say foundations of stress management, meditation, yoga, kinetic meditation with walking, these things are great. They don't work for, they don't resonate with everyone. Sometimes your foundation, you generate the list of things, and it turns out that after working all day, you come home, you have to cook dinner and do the laundry, and it just stresses you out. Sometimes our foundation has to do with scraping together the pennies for Instacart, you know, or outsourcing. It's time to ask those rascally teenagers they have to learn how to do the laundry. So sometimes our plans are not earth-shattering guru stuff. Sometimes it's just teasing out action plans for stressful situations. I absolutely consider it an imperative part of MS management. And as we learn more about the gut microbiome, I'll put money on it that we will eventually show that stress alters the gut microbiota in our MS patients to a disease-promoting state instead of a disease-protective state.
You know, we heard from a lot of our social media followers this week. They were excited that we were going to be talking about symptom management. We got a lot of questions, a lot of specific questions, but before we get to some specifics, this was really interesting. Someone wrote to us on Instagram asking, is there any hope that my symptoms will get better? Like my drop foot, it's been a year. So can MS symptoms improve?
Absolutely. Absolutely. It's more the norm that symptoms improve under, it requires comprehensive care. Yeah, we cannot just fix things by writing a prescription for a pill, right? And so for instance, for drop foot, and it's been going on for a year, I would need to examine you to see exactly which muscle groups are affected and what amount is weakness versus sometimes drop foot is a combination of weakness of flexing the ankle up, right? So it's relatively dropped, but sometimes it's, there's a muscle right behind your shin bone. Your shin bone is called your tibia. And right behind it is this muscle called the posterior tibialis. It gets tight in our patients who've had a spinal cord lesion. And when it gets tight, it pulls the foot down and in. And so that's why sometimes you didn't even realize you had drop foot until you rolled your ankle. And then when you got out of the boot, you're like, oh my gosh, my drop foot is awful. I actually am happy for my patients when I find that it's the latter, that it's due to the tightness of that muscle, because we can inject that muscle specifically with Botox to loosen it up. And so the management of that person's drop foot isn't just injecting Botox. It would be injecting Botox, gentle stretching on a daily basis, strengthening exercises, and then looking at, we do have some agents that are prescription that can improve conduction along neural pathways that have been affected by MS. And when people respond to that medicine, it gives them more endurance, and it allows them to interface even more meaningfully in PT. And so that the person out there with drop foot, don't give up until somebody does a really meaningful analysis of why you have drop foot and where it's coming from would direct how we treat it. Drop foot's tricky. For those of you who are on the call and you're thinking, I've had MS for 20 years, my neurologist has tried everything, and I still have drop foot. You're absolutely right. Also, sometimes we are not 100% effective at treating drop foot, but do not consider it a done deal until we pull out all the stops.
Earlier, you mentioned
Oh, can I
that.
say one other thing on that, John?
Yeah.
Kind of coming back to the tying in the nutrition piece. If you have weakness in a given muscle, there are a few things that you need in order that have to happen for any human to rebuild muscle strength. And that is sleep. We build our muscle while we're sleeping. You need 6 to 8 hours of sleep a night. You need enough protein in your diet. And so you can do the math, 1.2 grams per kilogram per day. It's going to sound like a lot. Shoot for at least half of that and then work your way up. And then you need resistance exercise. So although swimming is great for folks with balance issues, to rebuild muscle, you need to do resistance exercise. I know we can't go to the gym right now. You can get those exercise bands, and there are plenty of YouTube videos that you can look specifically. You never want to build up just one muscle. You want to do overall toning. But so again, the nutrition piece, we know from physical neuro rehab that people need enough calories, enough protein, enough sleep, and resistance exercise. And that feeds into our MS care as well.
Earlier, you mentioned that fatigue was a very common MS symptom, and the number of questions we're getting related to fatigue certainly bear that out this morning or this afternoon, depending on where you're tuning in from. Morgan wants to know if there's any help, like supplements or medications they can take for fatigue. And Rachel asked, does MS have an impact on sleep, which can have an impact on my fatigue, even if your scars aren't in the area that affects sleep?
Yeah, and I'm just taking some notes. Thanks.
Sure.
Yes. So again, I want folks to think of symptom management, such as fatigue or sleep, in a bigger way. So whole person health, and even beyond that, what we consider the patient ecosystem. So even your relationships with people affect your immune system and affect your health. Anytime we've looked at what's called therapeutic community, how many people do you have in your world that you can lean on, that you feel comfortable with calling or telling them, or opening up to them? Therapeutic community, whether we look at cancer survivorship or even recidivism, repeat hospitalizations for major depressive disorder, therapeutic community has a positive impact. So now we're starting way out here in patient ecosystem. You're thinking, I'm not saying, okay, go get 3 new best friends. But if you make a list and there are only 1 or 2 people on there, that's okay. That might be plenty. Or we might be able to network you to resources. The National MS Society is great. A few other groups are great. But so our ecosystem sets the tone of our internal physiology. And then our internal physiology is very complex with a lot of different systems. So this is why I think we often fail in Western medicine when we say, how do we treat fatigue? Well, write them a stimulant. Well, but what about what the big, we just went right in for this itty bitty piece, and it's so rarely effective when we try to problem solve like that, So in terms of, can MS affect sleep? Yes, unfortunately, the human condition affects sleep. So as we get older, sleep can get more disrupted and dysregulated. MS sometimes is almost like taking a magnifying glass to any human phenomenon. It's almost like MS accentuates it. So it can affect your sleep. MS can also indirectly affect sleep, as I was talking about earlier, say with bladder urgency, getting up during the night, or for a lot of my patients who have spasticity or muscle spasms, those get worse at night and can disrupt sleep. And lastly, for people who have that burning or itching or creepy crawly sensation in the feet or the legs, that also seems to escalate at night and can interfere with sleep. So it's a bummer because MS can directly and indirectly affect sleep in so many ways. And then we all know that when we don't get enough sleep, whether you have MS or not, you start to feel less well. So sleep hygiene and investing in your sleep is a really important part of general health and your MS care. Sleep is often our starting point for thinking about fatigue. Start big with therapeutic community, stress management, nutrition, exercise, and set the tone, because we want to set ourselves up for success, right? So we set a tone, we set a stage. And then once we get down to the symptoms, we look at the constellation so we can see how things are interrelated. Like I mentioned, sometimes fatigue management, once we address the big ecosystem, sometimes fatigue management isn't a stimulant. It starts with something that slows down your bladder at night. So management of your fatigue depends on what symptoms go with it. Fatigue, I love helping people with fatigue because there's so many levels of address, from things like stress management, sleep, might be pain management, bladder management. And then sometimes we do all these things, and you might be, some people on the call might be thinking, yeah, we did that. And you check all the boxes and you're like, I still have fatigue. And that absolutely can happen. But I guarantee for a lot of people, it will reduce the amount of medication you take. There's specific things with nutrition we can do for fatigue, movement, and then finally supplements. Yes, we have data on a few supplements with MS-related fatigue. And then finally, prescription medications. The supplements that we have good data for include L-carnitine, zinc, and coenzyme Q10. You need to talk to your healthcare provider about these supplements before you take them. I think a good way to think about things is, yeah, it's a supplement, but if it's strong enough to help with something, you want to make sure that it's not strong enough to do something you didn't want, right? So please talk to your physician. There are doses at which these things are helpful. And often when we do studies, we do what's called a dose titration. So for instance, with coenzyme Q10, we looked at 100, 200, up to 500. And at the lower doses, CoQ10 daily was not helpful, did not make a significant impact on fatigue scores. And we really had to get into that 400 to 500 milligrams a day. Again, I don't want you to go out and start taking it just because I slipped up and said a specific dose. It's hard to get hurt on CoQ10, but still, I can't prescribe things if I'm not your doctor. Zinc, I'm excited about zinc because a lot of my patients have had a favorable response to it. L-carnitine, less excited about it. But if, like so many of my patients, you actually have an affinity for supplements, again, talk to your doctor. The drawback in my mind is that the dose of L-carnitine that was helpful was 1,000 milligrams twice a day, and they come in these huge 500 milligram capsules. So now you're taking 2 in the morning and 2 in the evening, and I've had marginal success with it. There's data to support it. If your doctor is comfortable with it, it's certainly something that I recommend trying before you jump right in with a stimulant.
Well, thank you. Now, before we move on, we have a question for all of you watching today. What else would you like to see us do to support you as we make our way through this unusual time that we're all living through? If you have a suggestion, please type it into the chat box if you're connecting through GoToMeeting, or into the comments section on Facebook. And we'd appreciate hearing from you on all of that. I think that
you could, and folks, for those of you who take a minute to respond to that question, if you could please include not just what the MS Society could do better, but if you're experiencing challenges in terms of access to care or quality of care once you access it during this COVID time, could you share that with us? Because we're always trying to improve our system so we do a better job for y'all.
Well, thank you for that, Dr. Kraft. We appreciate it. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is reliable. So we'd like to share some resources with you, and these are resources that you can count on to be credible and current. So let me first circle back to something that I said earlier. If you are unable to get your questions answered today, please know that the National MS Society's MS Navigator team is available to answer your specific questions and connect you to the very best resources. I'll share all the ways that you can connect with an MS Navigator in just a moment. You can always check the Society's website at nationalmssociety.org/COVID-19 for complete, updated information on COVID-19 and MS. And you can visit the Centers for Disease Control and Prevention website at cdc.gov for the latest information about COVID-19 from the federal government. This is our 7th Ask an MS Expert webinar. And if you'd like to review any or all of the past webinars, as well as this one, you'll find that the video replays are at the MS Society's website at nationalmssociety.org/MSExpert. And you want to spell MS Expert as all one word. And I want to tell you about something new. The National MS Society recently launched a new Facebook group, the National Multiple Sclerosis Society Community. Now, participating in this Facebook group gives anyone affected by MS an opportunity to participate in self-paced learning units within a social setting. In addition to learning about health and wellness, symptom management, and other MS-specific topics, community members can connect with other group members to share information, comment, get advice, offer advice, and of course, find support. You can join that online community today by going to the Society's Facebook page. Finally, every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you take a few minutes and give Real Talk MS a listen. You can find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcast. I promise that we share all the ways for you to connect to an MS Navigator. And you can find them on the MS Society's website at nationalmssociety.org. You can contact an MS Navigator by telephone at 1-800-344-4867. That's 1-800-344-4867. Or of course, you can email an MS Navigator at contactusnmss@nmss.org. You can also connect with the National MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those posts and subscribe to the channels themselves. And you want to make sure that you get on the Society's mailing list by signing up at their website. That way you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with MS. Well, I'd like to thank Dr. Crabtree for sharing her knowledge and insights with us today. I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/MSExpert. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you're going to see a survey pop up in just a moment when we close out the webinar. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future webinars. The survey only takes 1 minute and makes a difference. So please take a minute to fill it out. On behalf of Dr. Elizabeth Crabtree and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.